Today I'm going to do a video on all the different uses that you can get out of an exercise ball, both before labor to try and kind of get labor going a little bit, during birth, as well as after birth. If you don't know who I am, my name is Allie. I'm a health and wellness coach, and I specialize in pregnancy, birth, new moms, and I try to bring you tips every week for one or all of the above. So please subscribe if you want to get updates. For my first pregnancy, I did not have an exercise ball. I waited until after I gave birth and then later found out all of the different uses for it during pregnancy, after pregnancy, during labor and birth. So I do highly recommend getting one. Now, when you're looking to purchase a ball, you do want to look at the size, which is pretty important. You ultimately want your legs to be at a 90-degree angle. I have sort of managed to achieve this. I got this ball for my birthday, and I had told my husband that I want an exercise ball. And my husband, thinking bigger means better, he got me the biggest possible ball you can get. So once we inflated it, it was so big, and I was like, my legs were basically at a 45. I was too lazy to return it though, so we just deflated it a little bit. So that's something that you can play with. If you do get a ball that's too big, you can deflate it. You could also probably return it. I was just lazy and decided to keep it. But that is something that you want to keep in mind when looking for a ball. One of the primary uses I get out of it on a regular basis is I actually use it as my office chair. If I were still working at an office, I would actually probably request that this is what I use as a chair, just because it does really help you keep your alignment and open your pelvic floor a little bit more. So this is actually a great thing to use as just a chair in general. One of the other ways it's really useful before labor and birth is to basically use as different core strengthening exercises or just stretching. So you can kind of, lean over and you get a really great side stretch, and if you kind of lean forward, you get a little bit in your hips and your back. And I've had some SI joint issues through both of my pregnancies, so that has actually definitely been really helpful in order to kind of just stretch and keep that area a little bit more loose. You can kind of always sort of move around, and just in general movement, especially if you have to sit all day, and this goes back to the office chair example, just moving a little bit so you're not just in a hard chair all day can actually be really beneficial to just kind of giving yourself and baby a little bit more variety, and it does help open up the hips and the pelvic floor a little bit more. And when it comes to strengthening, there are a bunch of different things that you can do in order to help strengthen that. In fact, when you're sitting down, it is constantly engaging the muscles down there. So if you tend to actually be really, really tight in your pelvic floor, you might not want to use this as a chair, because you do, for birth, need to be able to learn to relax the pelvic floor as well. And if you're always tightening and strengthening, then it's much harder to relax. Now, there are a ton of different ways to do core strengthening. One example is to engage your abs and your pelvic floor, and then kind of do balance moves. So sort of like a march in a way, where you're lifting up each side, and you can kind of really engage the core that way. It's a very light exercise. It's not like you're doing crazy planks on the floor or anything like that. But these are some of the things that do benefit you when you're trying to engage and strengthen the core a little bit before birth. You can also grab some dumbbells, or if you have like a band, and engage the core as well, and just do either rows or different arm exercises with dumbbells. If you want to do that, you just obviously want to make sure that your core is engaged. Now, I don't want to say this is going to be helpful to induce labor, but it will be something to help encourage labor to move along. So if you are nearing an induction date, for an example, these are a couple things that you can potentially do in order to encourage baby to move further down into your pelvic floor, in order to ultimately have baby come down and out. So all of these are encouraging baby to just kind of use gravity in order to come down, as well as opening up the pelvic floor a little bit. So for example, if you're watching TV on the couch and you're leaning back, you're actually closing the pelvic floor, and you really don't want to do that. It's not going to encourage baby to come down. However, doing things like leaning forward or opening your hips and squatting down, things like that will encourage baby to move further down into your pelvis. And if you are ready to give birth, these are things you definitely want to encourage. Same goes for during birth. You want to encourage baby coming down, and utilizing gravity and different movements in your body can definitely help that. And the birth ball is a great place to do this. So the first thing that you can do is basically a ball bounce. So you're just gently bouncing up and down, and you're ultimately just encouraging baby to go down into the pelvic region a little bit deeper. So your cervix starts to open, etc. I'm not going to spend too much time on that because I am not ready to go into labor yet. So that's just number one. So the second thing that you can do is just spiral on the ball. And this is just opening up your hips a little bit. Definitely go both ways. It's opening your hips a little bit, and it's letting the baby hopefully drop a little bit more. You can also incorporate a figure 8 into that, and it has basically the same effect. It's just a little bit more complicated, but it does have some benefits. And another one that you can do is sort of like a lunge, where you can kind of go back and forth. You can stay here for a little bit. You can bounce. And this is all just doing the same thing, using gravity to encourage baby to come down a little bit. It's also stretching a little bit, which can be good. So even if you're not trying to induce labor, this is another great way to sort of stretch this area out. Now, during labor, you're kind of looking for the same thing. Anything to help move baby down and out is really the goal. Now, that is counterproductive to laying down in a hospital bed. So before you're going to the hospital, if that's where you're giving birth, you do want to try to get baby as far down as possible. So moving as much as possible, or incorporating these throughout early labor or active labor while you still can, is the most ideal situation. And it's even better if you chose a hospital that will allow you to do things like give birth while you're squatting rather than laying down, or, are more flexible with different positions, being on all fours, that kind of thing. So here are a couple things to try both during contractions, between contractions. You can try to see what works for you, what's comfortable for you. But here are just a bunch of things that I'm going to throw out there for you to do. First is just swaying on the ball with your hips open like this. It's pretty self-explanatory. It actually feels really great. So that's number one. Number two is just spiraling on the ball. We already talked about that. Same with doing the figure 8s. 3 is just bouncing on the ball. You might want to do this more in between contractions rather than during contractions, but it really depends on what kind of labor you're in and how you're feeling. Most of the next ones are going to be on the ground. So I'm going to reposition. So squatting. Depending on how strong you are with your squat, any kind of squat is helpful. And as I mentioned, laying down is too. This is something you might want to practice ahead of time, depending on your squat capability. If you can't get all the way down and sort of move in between, you just don't want to be in a really precarious position, obviously, when you're in the throes of labor. So another way to do it is basically just put most of your weight of your chest on the ball and then squat this way. This really helps opening the hips and, again, helping to bring baby down. You also necessarily don't have to squat. You can just lay on the ball. This is actually pretty popular, and it does allow for that same chest. It's a little bit definitely easier on your hands and wrists because you don't have to put them on the ground, but just being on all fours also is really helpful. Now, most of these you can achieve too without a ball, or just with having something else. So if you're a partner, if you want to be trying to spiral your hips, you can try to lean on your partner and spiral your hips, or squat, or put a rebozo around his or her neck and really kind of get into that squat that way. I will say I did that with my husband during my last labor, and he was in a lot of pain in the days following just because I relied on him so much. Whereas if I had a ball, I could actually lean on it. So that being said, even if you don't have the ball, again, you could kind of be on all fours. You can get pillows and try to lay on those and be able to sway your hips back and forth. Just moving and creating space in your whole pelvic area is going to be helpful for this. And now, after birth, one of the things that you can do is, with your baby in your arms, you can just bounce. And they love this. They love this because they've just been bouncing. Every time you walk, they're in your belly, they're hearing all that white noise, and they're just bouncing. So that's why babies love to be held and carried. And, rather than having to constantly hold your baby, if your baby really loves to be held, which almost all babies do, you can just sit and quietly bounce. And it really does help soothe them and is hopefully easier on you as well. And then lastly, and this is why I bought the ball in the first place for my previous pregnancy, but when it comes to rehabilitating your core after birth, a birth ball or a exercise ball can be really helpful with that. I do recommend 6 to 8 weeks after giving birth to try to see a pelvic floor PT and kind of see where you're at with your core strength. A lot of times abs get separated a little bit. It's called diastasis recti, and strengthening your whole pelvic floor region as well as your abs can be really important to the health of your core. They can give you some great exercises to try to rehabilitate your core in order to prevent any issues that you might have in the future, and it will just allow you to get back into a routine of trying to recover your body as best as possible. So that's it. Thanks for watching. If you want to get more healthy tips about pregnancy and baby, etc., please subscribe to my channel, and I'll see you again. Bye.